Day. Watch us via Roku on your smart TV. Submit your own content to 1530entertainmentllc@gmail.com. Download the Millennium TV app from the App Store to stream our shows anywhere, anytime. Millennium TV.
Welcome to Millennium TV 24. I am Kim Seabrook, and thank you for tuning in. As you know, I like to start off with New York news. So let's take a good look. And let's see what we have today. New York City cooling centers open Sunday as potentially dangerous heat arrives. I definitely want to inform you about that, especially for our elders. New York City's Emergency Management Department is opening cooling centers starting Sunday, which is today, as potentially dangerous heat comes our way. Temperatures are expected to soar into the low and mid 90s with very high humidity starting Monday. I also heard it was going to probably get up to 100 degrees. So face coverings will be required inside all cooling centers, and social distancing guidelines will be in place. But to find a cooling center, all you got to do is dial 311 and you can get the information you need. So starting off with the real news, we want to talk about Johnson & Johnson, the same people who just came out with a vaccine, right? Is to pay $230 million to settle New York opioid claim. Johnson & Johnson has agreed to pay $230 million to New York State to settle claims that have helped fuel the opioid crisis, Attorney General Letitia James just said this Saturday. The pharmaceutical giant also agreed to permanently end the manufacturing and distribution of opioids across the U.S. James also cited that in a statement the other day, but the company helped fuel this fire. But today, they're committing to leaving the opioid business, not only in New York, but across the entire country, she said. It has to be something more to it. Let's keep going into this. But the deal in a lawsuit brought by James in 2019 removes Johnson & Johnson from a trial that is slated to begin next week on Long Island, part of a slew of litigation over an epidemic linked to nearly 500,000 deaths over the last 2 decades. In addition, I do have a guest who is going to talk about this as well. That's why it was very important that I start off with this. Saturday, Johnson & Johnson downplayed the Attorney General's announcement. The company said that the settlement involved 2 prescription painkillers developed by a subsidiary and accounting for less than 1% of the market that already are no longer sold in the United States. The settlement was not an admission of liability or wrongdoing by the company, Johnson & Johnson said. It added that its actions relating to the marketing and promotion of important prescription pain medications were appropriate and responsible. But the settlement was the latest development in a complicated array of opioid-related lawsuits across the United States that has drawn comparisons to multi-state litigation against tobacco companies in the 1990s. Some big drug companies see settling as being in their best interest, in part because that route would likely not cost as much as losing in court repeatedly. Johnson & Johnson, along with pharmaceutical distributors America Source Virgin, Cardinal Health, and McKesson, announced that last year they were offering a total of $26 billion over 18 years to settle all cases that they face, with the money going to abate the crisis. Good news for you. So let's go into Michigan. And Michigan calls the EMS for probable overdoses up 13%. So this is not just going on in New York. This is definitely a worldwide problem. But let's go. Overdose up 13% so far in 2021. The number of EMS runs for opioid overdoses have increased again this year. And that's according to data provided by the Michigan Department of Health and Human Services. So across the state, EMS units responds to 13% more probable opioid overdoses during the first 5 months of this year compared to the same time frame in 2020. The breakdown from January to May, 5,782 runs this year, 5,121 runs in 2020, and 4,500 in 2019. Last year's increase over 2019 was blamed largely on the pandemic. Isolation, boredom, and fear led people to increase drug use, and extra money added to unemployment checks made street drugs, which have become deadlier than ever because they are being cut with the ultra powerful synthetic opioid fentanyl, especially affordable. Fewer spots available in rehab facilities because of social distancing and reduced access to in-person support groups because of restrictions on large gatherings only compounded the problem. So in March of this year, Michigan entered the third wave of the pandemic. By April, the state had the worst rate of COVID-19 infection in the nation. Earlier this month, health experts declared that the state's third surge to be over. And earlier this week, Governor Gretchen Whitmer lifted most restrictions that were in place to stem the rate of the infection. So will the increase in EMS run continues even as the pandemic appears to be winding down? This is a good question. So far, there's been no stopping fentanyl, which is involved in the majority of the state and the nation's overdose deaths. In addition to being mixed into heroin and pressed into counterfeit pills, the Drug Enforcement Administration said recently that there's also evidence is being added to a new type of super strong methamphetamine. So in many cases, drug users don't realize that they're taking drugs laced with fentanyl. Provisional data from the U.S. Centers for Disease Control and Prevention shows that Michigan reported 2,692 drug overdoses deaths for the 12-month period that ended in November 2020. That figure, which the CDC says is undercounted due to incomplete data, represent a 13.4% increase in overdoses year over year. Most of them are unfortunately opiate related. But next, in Miami, another body in rubble raises death tolls to 5. Rescue crews found another body in the rubble of a collapsed 12-story condominium tower near Miami on Saturday, raising the death toll to 5 as they raced to recover any survivors while fighting back fire and smoke deep inside the concrete and metal remains. Miami-Dade Mayor Daniela Levine Cava announced that the new toll at the evening media briefing, saying that the discovery of the body dropped the number for unaccounted down to 156. She said crews struggling throughout the day in the debris also found other unspecified human remains. The mayor also said that the reason for the missing number went down by 3 was because authorities had identified 3 bodies. Officials said that the remains they find are being sent to the medical examiner and that they are also gathering DNA samples from family members to help identify them. Throughout the day, she also noted rescue workers continue to go over the massive mountain of debris with rescue dogs and sonar, searching for any survivors. Our top priority continues to be search and rescue and saving any lives that we can, she said. Authorities announced that they were beginning an audit of buildings nearing the 40-year review, like the fallen Champlain Towers South, to make sure that they're safe. The mayor asked other cities in the county to join the building review and said that there will be state and federal funding to help. Federal Emergency Management Agency officials have joined local and state authorities at the site, DeSantis said. He also added that a nearby sister building of the collapsed tower is also being looked at because it was built at the same time and with the same designer. But late Saturday, Surfside Mayor Charles Burkett said that a city official had led a cursory review of the nearby Champlain Towers North and Champlain Towers East buildings. But they didn't find anything out of the ordinary, he said. He emphasized that the priority now was on rescuing anyone that's still alive. What we're doing now is we're saving lives and we're bringing people out of the rubble. What we're going to do in the next phase, after we address the support for the families, is we are going to do a very deep dive into why this building fell down. And I imagine that this is going to be a very comprehensive sort of project, Burkett said. Burkett also stated earlier that he was working on a plan to temporarily relocate residents of the Champlain Towers North, which was constructed the same year and sits about 100 yards away from the collapsed building, and that FEMA also has agreed to pay for lodging. The mayor said he didn't plan to order residents to evacuate, but if he lived there, I'd be gone. The first team members arrived Friday, said Jason Averill. He's an official at the National Institute of Standards and Technology. That agency also investigated the collapse of the Twin Towers on 9/11, the Joplin, Missouri tornadoes, and Hurricane Maria devastation in Puerto Rico. Separately, the government of Israel said it was sending a team of engineering and rescue specialists to assist in the search. Israeli media have reported that some 20 citizens of that country were believed to be among the missing. I don't know, but that sounds kind of interesting to me. Another 22 people unaccounted for were from Argentina, Venezuela, Uruguay, and Paraguay, including relatives of Paraguayan First Lady Silvana de Abdo Benitez. Sounds fishy. Let's see what they come up with. But next in New York City, Essential Workers Monument protested ahead of construction days ahead of the planned construction on a monument in Battery Park City to honor essential workers who have served on the front line of the COVID-19 pandemic. Protesters stood outside the site, calling for a stop to the project. Demonstrators gathered Saturday near the construction site in hopes of saving the green space before it's replaced with the Circle of Heroes. The group says that there have been no public meetings or hearings about plans for the monument, which will call for chopping down trees and replacing grass with concrete. Governor Andrew Cuomo this week announced the monument will include 19 red maple trees, symbolizing the essential workers that carried New York City, New York in general, through the pandemic, including nurses, doctors, healthcare workers, transit workers, police officers, EMTs and paramedics, firefighters, correctional officers, store employees, the National Guard government, and employees building service workers, utility, and communication workers. Don't forget the delivery drivers, teachers, sanitation workers, construction and manufacturing workers, and not to forget, not least, but the food service workers and hospitality workers. These trees, this green space is the largest green space south of Central Park. Parks were vital to the city getting through COVID, and we just want to make sure that we don't end up doing something that we can't take back. And that was said by Tristan Sell of the Battery Park City Parents Association. We want to measure twice and cut once. A spokesperson for the governor stated that the state was proud to plant 19 new trees at the park in a public space to be enjoyed by all New Yorkers. Additionally, on Wednesday, it was announced that New York State would provide $25 million in child care scholarships to all essential workers. And we still have some more news before we go into the break and bring in my next guest. We have Bruce Springsteen on Broadway. Yes, the anti-vaccine protesters demonstrate outside show. Bruce Springsteen fans were not the only ones at the St. James Theater on Saturday for the first performance of Springsteen on Broadway since the COVID-19 pandemic. So, about 36 vocal anti-vaccine protesters were outside the theater on Saturday evening. They voiced displeasure that the show is seating only fans who have been vaccinated from the novel coronavirus. But I think we learned that in the 60s that segregating people isn't right, said a female protester holding a sign that read, "Bruce Springsteen is for segregation on Broadway." She declined to give her name, but you can't segregate a crowd for medical choices. Are you going to start separating people who have AIDS or hepatitis? A man in a pink bandana and bullhorn said, "Welcome to Nazi Germany." A similar group of anti-vaxxers protested the Foo Fighters show at Madison Square Garden last Sunday. The show also had a similar vaccine requirement for fans, but Springsteen on Broadway is scheduled to run through September 4th, and that the anti-vaccine protest does not stop the show. But they make a very, very valid point. I think it's definitely going to be some segregation between people who are vaccinated and not vaccinated. So what I want to do is go into a commercial break. My name is Kim Seabrook. We'll be right back with Millennium TV 24.
Millennium TV, bridging communities worldwide. We broadcast diverse international content from Europe, Asia, Africa, and now right here in the USA. Watch us via Roku on your smart TV. Submit your own content to 1530entertainmentllc@gmail.com. Download the Millennium TV app from the App Store to stream our shows anywhere, anytime. Millennium TV. Millennium TV, bridging communities worldwide. We broadcast diverse international content from Europe, Asia, Africa, and now right here in the USA. Watch us via Roku on your smart TV. Submit your own content to 1530entertainmentllc@gmail.com. Download the Millennium TV app from the App Store to stream our shows anywhere, anytime. Millennium TV. Millennium TV, bridging communities worldwide. We broadcast diverse international content from Europe, Asia, Africa, and now right here in the USA. Watch us via Roku on your smart TV. Submit your own content to 1530entertainmentllc@gmail.com. Download the Millennium TV app from the App Store to stream our shows anywhere, anytime. Millennium TV.
Welcome back to Millennium TV 24. As I mentioned in the beginning of the segment, we wanted to discuss the opioid issue that is happening in New York, and who is none better to bring than my guest, Marilyn Reyes. Marilyn Reyes, where are you, darling?
Hello.
Hi. I'm doing great. It's always an honor to just be in your presence. We appreciate all the work that you do in the city. So I want to just start off with, you are the co-director of Peer Network of New York. Is that correct?
That is correct.
All right, Madeline. So give us some feedback. I know you're from the Bronx. I know you had your run-in with the streets back in the days, but now you overcame everything and you are taking control. You are assisting others. Let us know what Peer Network is and what you do.
The Peer Network is an organization that is from top to bottom is peers, and everyone in the Peer Network has lived experience. So we give back to the community by educating, doing naloxone trainings, and just trying to improve the lives of people who use drugs and engage in sex work.
Got it. So what's going on in New York City? Every time I'm researching news, I'm noticing that there is a huge crisis in the opioid, situation, and then this thing with fentanyl that's being put in the drugs, which is making things worse. What's going on when you go out in the streets? What are you seeing? Give us a visual, and what do you do?
Well, when I go onto the streets, I see people, what we do mostly is go out there and make sure that everybody has a Narcan kit, because drug users are saving drug users.
Okay. What is that kit? I'm sorry, for people who don't know, what is that?
Naloxone is the medicine that reverses an opioid overdose. It's a little blue kit like this.
Okay.
Right? And inside is the medicine that reverses an opioid overdose. It blocks the receptors. Because when you're having an opioid overdose, it blocks, your body stops breathing. So it blocks that so you could breathe.
Wow.
Because the opioids just slow down the breathing, and that's why people die. And they're contaminated. All our drug supply is contaminated. I'm getting more overdoses now with cocaine. There's some, because usually people think heroin or opioid pills, but it's bigger than that. It's the cocaine, the methamphetamine, everything has fentanyl in it. Everything is being contaminated. So our drug supply is poison. And it's bad. It's really bad out on the streets, and people now are also getting that abscess in their arms for people who inject drugs. So the infection rate is higher now. It's like people don't want to go to the hospital because stigma and judgment is also killing our people. And it's really sad. How you speak, language is powerful. How you address people who use drugs, you gotta embrace them and love them and still, try to help them. I come to harm reduction. Harm reduction is just simply, we don't condone, or endorse drug use or sex work. We just meet people where they're at, educate them about the harms that come with drug use, and just try to teach them how to stay alive until they're either ready to stop, and if they're not, they can still stay alive by just practicing certain techniques.
Well, that's nice what you provide to the people in the streets, because there's so many people who place judgment on drug users, they don't have to do it anyway. No, they don't. But if you grow up in New York City, you understand why some people are doing things because of depression or just peer pressure. Growing up in that environment, there are just situations where people do drugs, and it's not to blame or point a finger. But it's nice that we have a group of people, including yourself, to go out there and be able to reach. And now what I want to emphasize is that not everybody you see in the street is homeless. Is that correct?
That's correct. That is correct. People don't use drugs because they're homeless. People use drugs because of trauma.
Right.
And most people, some people are not homeless. And that's a fact. Homelessness is, some are homeless, but homelessness doesn't lead, like they connect drug use and homelessness together. And that's not true.
Right.
That's absolutely not true. People become homeless for all different reasons. It's not about drug use. Mm-hmm. I'm not saying that some don't, but I'm just saying that not all people who are homeless are drug users.
Exactly, because I just noticed that that's what a lot of, the perception is. Oh, he's homeless, he's a drug user, or because you're doing drugs, you're homeless. No, there's people who are in their homes who are overdosing, not just people who are out on the streets.
Right, it's happening everywhere, everywhere. And like I said, people that don't know about opioids and are using other substances as cocaine, crack, marijuana, all that. We've been hearing they're putting in the marijuana too.
Wow.
I don't have facts. Yeah, I've heard it in the streets. But I'm just saying, it's like we're being murdered, and something, we have to train everyone to use naloxone. I think every store owner should have a naloxone kit. I think every first aid kit in restaurants should have also a naloxone kit. I think everyone should learn how to use naloxone. It saves lives.
I totally agree.
And that's what we want to do, keep people alive, because until they're ready either to stop or not stop, it doesn't matter which way they're going. What matters is that they stay alive until they're ready to make any other changes in their life.
So I know that, just like you said, they need to make changes in their lives. But what do you think the city should do or the state should do? What is causing the fentanyl to get here? Like, how can we stop this? I know this is a very difficult question, but what can we do? It
is, but just support. I mean, we need more funding for harm reduction. The peer network needs funding. And during COVID, I don't think they have the correct numbers, but that's my opinion, because when it came to COVID, let me see how to put it, they would respond to COVID patients first, and they wouldn't respond to overdose people.
Wow.
And if you had COVID and there was an overdose with COVID, they're going to claim COVID, because COVID, the hospitals were getting paid.
Exactly.
Each COVID patient that was diagnosed with COVID the hospital got $13,000.
Thank you.
For every COVID patient that was put on a ventilator was $34,000.
Exactly. And so people who didn't even have COVID, let's be realistic, people were dying. And this is where I also did a recent article as well, that with cancer patients, it's less people die from cancer. No, it wasn't that. You guys were putting COVID instead of saying that they passed away from the cancer things. And it's crazy. It's crazy.
It's insane, because it's about the money. It should be people over profit, not profit over people.
Exactly.
And that's a big issue. Governments don't really care about us. I mean, we got to save ourselves. Why do you think I don't get no funding for the peer network? And very little is some. We go from different agencies to different agencies to get naloxone kits, to get syringes, to get condoms, to get everything that we need to provide to the community so they can learn to be safe. Because no one's going to save us. We got to save ourselves.
That is crazy. So let's say, all right, so you have funding. How can people help your organization with some funding?
Well, we have a website, and in there, Vocal New York is our fiscal sponsor, and there's a link where they could go in the site and donate money.
Are you also needing people volunteering, or do they have positions open where people are getting paid, where maybe people can run the streets
right now,
and help?
We got a little funding, so we did some extra outreach this past month. And, whenever we get a little funding, we do a little extra. We already have 12 peers. It's a process because you have to get educated because we do syringe pickup on 149. And
149th Street.
Yeah, 140. I'm the heart
I can imagine what that's like.
Yeah, I want to hit Fornham Road next because there's a lot of up and down on Fornham Road in certain areas. There's a lot of drug use and people need to be safe. So coming with the education and the tools so they can stay safe and alive.
What?
But one point.
Go ahead.
In 149 we've been doing some extra outreach and just educating people on drug use, educating them on naloxone, giving out naloxone kits, and also giving out food because people are hungry. COVID didn't go nowhere. COVID is still here, and people need assistance. I mean, the homeless crisis is not helping. There's about 92,000 people homeless. I mean, they're not doing nothing to help. They stick you in freaking shelters that are overpopulated. It's too many people. People don't want to be in shelters. They rather be in the street because there's a lot of stuff going on in shelters that are unfair and unjust, and people don't want to be there. And I was like, I would not want to be in the shelter myself.
Yeah.
But they do better. They need to provide housing. They need to provide real treatment because when you go to these treatment centers, they give you the runaround, and you need so much paperwork. You need so many things to get treatment. When treatment should be easier to access because people are dying. Government Homeland needs to pay the harm reduction contract and let us get funding.
No, it's so true. I remember when I worked in a health center and this man came in wanting help to go to a rehab. I stood there with him for way past my hours than I was supposed to. And the runaround that they gave him, the hard time when he's asking for help. He is asking for help. We just need to be able to have the access to help them without any questions, what color underwear you're wearing, and anything of like that. When was the last time? And then you have to be under the influence in order to get in. I'm explaining. So you want me to go out there and get high and just make my situation worse and maybe never come back to you because you're telling me to go hit the streets. So yeah, it's a huge problem. But what my question is, once you do get the people off the streets, you help them, where's the real help afterwards? What happens after?
Right. And that's another big issue because you go to treatment, you're in there 7 days, then you go to rehab, which is like 21 days, and then if you want long term, that's another process. Some people don't even get it, but they throw you back out into the street. So what's the point?
Exactly. Where is the help?
It's not the help. They're not helping. I mean, even for methadone, like you have to go through this whole scenario to get on methadone. Then the urine test every week. It's like it keeps people like giving up.
Exactly.
It's an oppression.
It is. It makes the person more depressed. You're not helping them. You're putting them through more mental anguish, and they have enough things on their mind, enough things in their heart, in their spirit that is breaking them down already. So when we make it more difficult for them, we don't help. It's not helping them.
It's not. And then when you ask for certain things like safe consumption spaces, which is overdose prevention centers that the mayor said he was going to put, and people right away take the impression that it's a place where people use drugs. It is a place where people will use drugs, but it also will have mental health detox. It will have a number of services that our community desperately needs to get better.
Oh my
It's about
God.
healing the community.
Yes, unfortunately, our time is up. I know we could speak on this forever. I'm definitely going to bring you back again, Marilyn. But I do, before I let you go, I want to give you your flowers. I want to tell you thank you for always having a beautiful smile on your face. I never see you angry, even as much work as you're out there in the streets with everyone. Continue doing what you're doing and be a blessing to others, as it is an honor to share space with you. And thank you so much for coming in, and we'll be back with you.
All right. Thank you.
You're welcome, Marilyn. All right, we're going to a commercial break. I'm Kim Seabrook. We'll be right back.
Millennium TV, bridging communities worldwide. We broadcast diverse international content from Europe, Asia, Africa, and now right here in the USA. Watch us via Roku on your smart TV. Submit your own content to 1530entertainmentllc@gmail.com. Download the Millennium TV app from the App Store to stream our shows anywhere, anytime. Millennium TV. Millennium TV, bridging communities worldwide. We broadcast diverse international content from Europe, Asia, Africa, and now right here in the USA. Watch us via Roku on your smart TV. Submit your own content to 1530entertainmentllc@gmail.com. Download the Millennium TV app from the App Store to stream our shows anywhere, anytime. Millennium TV.
Coming back and checking in with us and taking a good look on this news today. We just had Marilyn Reyes, and she is from the Peer Network of New York. So if you want to help, you want to donate, this is a big issue, crisis that's going on in New York City and across the world. www.peernetworkofnewyork.org. And I want to relate something that it says here. How we walk with the broken speaks louder than how we sit with the great. That is a beautiful statement. But let's move forward, and I want to thank you again, Ms. Marilyn Reyes, for chiming in with us and giving us all that information. But in next news, what do we have? So, 3 wounded in 2 separate New York City shootings overnight. Unfortunately, I have to break this news in, but let's get this over with. 3 people were wounded in 2 separate shootings overnight across New York City. Cops said just Saturday, a 22-year-old man was struck 3 times in the right leg when bullets went flying at 3:40 a.m. on 27th Avenue and Borough Place in Woodside, Queens. Police and sources said at least 24 shell casings were found at the scene, and the victim was rushed to Elmhurst Hospital in critical but stable condition. Hours earlier in the Bronx, 2 men were wounded following a squabble at 11:10 p.m. Friday on Morris Avenue near East 196th Street in the Kingsbridge area. And a 26-year-old man was shot in the buttocks and transported to St. Barnabas Hospital. And again, that's in the Bronx. A 20-year-old man walked into North Central Bronx Hospital with a gunshot wound to his right leg, and both men sustained non-life-threatening injuries. And that's that news for the Bronx in New York. Moving forward, California, New York, and Louisiana are creating databases for people wanting to prove that they are vaccinated. Restaurants, stores, and other businesses across the country are allowing vaccinated customers into their establishments, but that's without masks. But some require customers to show proof of vaccine shots. But what about HIPAA? That's my question. What about HIPAA? Isn't there a law about privacy? But most are just relying on the honor system. The science is clear. If you're vaccinated, you're safe, said President Joe Biden. I don't know. But some big Wall Street investment banks like Morgan Stanley and Goldman Sachs are summoning employees back to the office while also demanding proof of vaccination. Meanwhile, 3 states, California, New York, and Louisiana, are allowing state residents to access digital records of their vaccine shots. On July 8th, another state, Hawaii, will end its COVID-19 testing requirement for travelers from the United States mainland if they upload proof of vaccination. In New York, restaurants are getting a spike in business from people who now feel safe to go out. Yeah, it just gives us like an added sense of comfort. So when you're coming into a restaurant, perhaps to grab some food, a glass of wine, you know everyone else around you is also vaccinated. And that was said by Abby Shepman and Phil Dawkins visiting City Winery in New York. And at least 18 Republican-led state legislators are prohibiting the requirements or enforcement of so-called vaccine passports. But in December, the Equal Opportunity Employment Commission determined that it is legal for employers and states to require people to get vaccinated. That's based on a legal precedent from 1905 for the smallpox shot. 1905, that's where we need to review and renew some things. But the Biden administration is strongly encouraging vaccination for COVID-19, but isn't making it a national requirement. Still, people are fighting back. They're fighting back against vaccination demands. 8 students from Indiana University are suing the school over its required shots. They're being stripped of their constitutional rights to make medical treatment decisions for themselves. And that was said by the students. Students attorney Janie Bopp Jr. But technology like New York's Excelsior Pass, which provides digital proof of vaccination, may soon become the norm. Major companies and retailers, including Apple and Walmart, are planning to create new systems around the concept. This is going to be very interesting in the next couple of years. But moving on, New York City Mayor de Blasio is mocked for a tweet on bright future of Big Apple amid city's crime wave. So Mayor Bill de Blasio is getting dragged on Twitter for bragging about enjoying the Big Apple summer weather as violent crime soars and residents are moving out in the droves. Okay, so he's at an event with kids and he's saying that it's a beautiful day. I know that there's issues and things going on in New York, and yes, he's the mayor, but is he not allowed to say that it is a beautiful day, especially when working on kids? Yes, we understand the things that are going on, but it's a beautiful day. There's nothing wrong with that. So the future of New York City is so bright, I gotta wear shades. And that's what he said. He tweeted days after city primary voters appear to have rejected his legacy by choosing a moderate ex-NYPD captain as their next likely mayoral candidate. So it was de Blasio's second attempt on the subject, after deleting a similar tweet and being mocked over the reflection of what appeared to be a woman's t-shirt chest reflected in his mirrored sunglasses. I'm telling you, people just take everything to the extreme. The future isn't so bright for these kids, one Twitter user replied, linking to a news story about a horrific daylight shooting in which a masked gun murdered a man on a public street just inches away from 2 terrified children. But for a pompous blowhard like you, I'm sure it's great. The only thing bright is arguably the broad daylight under which many of these crimes have taken place. A Jeep veered onto a Bronx sidewalk last week, mowing down a family of 6, according to the New York News. A fight in Manhattan that same day left a man with a stab wound to the stomach just before the suspect hopped in a car and crashed it 4 blocks away. Not to mention a campaign volunteer for Eric Adams, the ex-cop and leading Democratic mayoral primary candidate, was stabbed in the Bronx over the weekend. And the Story Greenwich Village neighborhood, where an average home costs $1.3 million. Police say crime and anarchy are rampant. A bike-riding bandit allegedly snuck into an apartment through a 10-year-old girl's window and rubbed on her feet. Not even the area around Central Park is safe. Surveillance video recorded the afternoon execution of a 20-year-old man in a car between Lexington and Park Avenue just a few weeks ago. Yes, that is terrible news. But de Blasio didn't appear to have any of that on his mind when he was photographed wearing a peach-colored Hawaiian shirt and Bermuda shorts in a series of photos celebrating the reopening of the city's public schools. Again, everybody is just taking this way overstream. I put this on purposely just to discuss it. It's okay to say it's a good day if we're having a good day, especially when you're around kids. But moving forward, if you want to improve your heart health, say goodbye to low-fat diets. So instead, Emphasize plant-based foods to lower your risk of stroke and heart disease. You know I had to bring that in, right? Research shows cycling offers big-time benefits for your ticker, your heart, but that's backed up by studies like this one and this one. When it comes to nutrition for better heart health, the standard advice is to lower your fat intake may not be the best track. And that's according to the research presented at the recent Nutrition 2021 live online conference. So researchers looked at data from a nutrition study that followed about 5,000 people over 30 years, tracking their food choices as well as their prevalence of cardiovascular disease and stroke. Two types of diets, low-fat and plant-centered, were both associated with lower LDL, that means bad cholesterol, but the latter was also linked with lowering long-term heart risk. The plant-centered diet emphasizes fruits and vegetables, whole grain, nuts, seeds, low-fat dairy or no dairy, and fish, while limiting red and processed meats, sugary treats, salty snacks, and soda. The low-fat diet focuses on lowering saturated fat in the diet as much as possible. The researcher team leader David Jacobs said that in a statement, dietary guidelines in the U.S. and Europe have recommended eating low amounts of saturated fat specifically for its heart's benefits. But while this is not necessarily wrong, he stated the study results suggest plant-centered diets may be even better. So in part, that's because targeting only saturated fat may not take into the account the healthy fats that come from plant-based sources, he added. So for example, that can include walnuts, avocados, and olive oil. But another major factor is that the plant-centered diets will be high in fiber, antioxidants, vitamins, and minerals, and all of these are both directly and indirectly related to long-term heart health. Plus, plant-centered diets will generally be lower in saturated and trans fats, so you're actually getting the best of both worlds. That's right. So while plant-forward diets will still have many healthy fats, they tend to be more unsaturated fatty acids, which are healthier for the body and the heart. It's best to consult with a nutrition or medical expert if you're considering changing your diet to meet your specific health and performance goals. But as we all know, the world of nutrition is always changing and evolving as researchers learn more. And you can also do the research on your own and get that information. So next, weight loss wonder drug that blitzes body fat may also reduce risk of heart attacks and strokes. A weight loss wonder drug that blitzes body fat could also slash UK deaths from heart attacks and strokes. The drug called Rybelsus is a daily pill which was approved for US and the UK last year as a major new treatment for obesity and type 2 diabetes. It cuts calories intake by mimicking the effects of naturally occurring hormones, and that's called incretins, which are released when we feel full after a meal. But now a team of British scientists plans to investigate if the once-a-day pill will also slash heart attacks and strokes in millions of patients with type 2 diabetes. They believe that, as well as triggering weight loss, that the drug could reduce blood pressure, halt the buildup of harmful deposits in arteries around the heart, and to keep blood sugar levels from rising. So making it a potentially powerful new weapon in Britain's battle against heart disease. But in recent years, a new class of drugs called glucagon-like peptide, which is GLP-1 receptor agonists, have transformed diabetes treatment. What they do is they work by triggering substantial weight loss in patients unable to fight the flab through the healthy diet and exercise alone. But most need to be injected once a week by patients themselves using a do-it-yourself pre-filled pen-like device. Rybelsus, launched in the UK last September, is the first GLP-1 drug that comes as a daily pill. Researchers at Oxford University Nuffield Department of Population Health are setting up the new trial because some studies suggest that the drug may do much more than simply reduce body fat. So one animal study found GLP-1 drugs also reverse the buildup of harmful deposits called plaques that's in your blood vessels around the heart. Plaques can also trigger heart attacks and strokes if they become inflamed, break loose, and cause a blockage. So more information on that as we stay in tune with that. I'll follow up and see what's going on with that. But next in sports, the Sun took a 3-1 series lead over the Clippers in the lowest scoring game of the NBA. Devin Booker scored 25 points before fouling out in the final minute. Chris Paul made clutch free throws on a night everyone was missing, and the Phoenix Sun escaped with an 84-80 victory over the Los Angeles Clippers on Saturday night to take a 3-1 lead in the Western Conference Finals. The Suns can advance to the NBA Finals for the first time since 1993 with a victory Monday night in Phoenix. All right. And last but definitely not least, you know I love to do my community news, so I'm thankful for anybody who brings me this information, as we like to keep our people informed. So, when our girls speak, we listen. This is what was said. And after over a year of separation and Zooming, our girls want to have fun, grow, and reconnect with their peers. On July 12th, NOMW, which is not on my watch, so they were doing a poetry group on Zoom, also putting a poetry book together. So again, during all this COVID, everything has been a Zoom, but now we're putting a summer camp together. So let me move forward. Club Alternatives in person. So Selfie Arts and Empowerment Summer Program will begin. The site location is at the Elegant Sands Banquet Ball. That's 817 Allerton Avenue in the Bronx. Again, that's 817 Allerton Avenue in the Bronx. And what they're going to do, they're going to have combined the best of traditional summer programs, which will include amazing friendships, creative activities, fun games, community engagement with a powerhouse of female mentors from various industries. Informative workshops. We're going to have small group chats, poetry, journaling, visual arts, exercise, and theatrical production, thus creating an exciting summer experience for girls. So our girls will build life and leadership skills that will help them confidently navigate life. So if this sounds like something that's exciting, register the young girls, your young girls in your life, and share this information with others. Please, please, please. Let's give our girls an unforgettable summer. To register, you can contact Pamela Damon at pamela@nomwi.org. Again, that's pamela@nomw.org. I'm Kim Seabrook. We are wrapping this up. We'll see you next time on Millennium TV 24. Thank you for taking a good look in the news. We'll see you next time.